Greetings, welcome to the Diabetic Mogul podcast. On this podcast, we will offer standard and recommended practice of not only managing your diabetes goal, but how you can get involved in advocating for proper access to healthcare and bringing opportunities within the diabetes online community. It's Tino, a patient advocate and a certified diabetes educator.
I'm Hona, I'm a medical doctor. Together, we want to raise awareness, open a discussion about diabetes, share ideas, thoughts, different perspectives, and overall create a safe environment for everyone who needs to express his or her thoughts.
We'll be hosting a series of podcast episodes from people living with diabetes, caregivers, healthcare providers, researchers, and we encourage you to get involved, get engaged, and come up together to create the change that we need. Welcome to the Diabetic Mogul podcast. So today I have Negin. I might just have to let you introduce yourself so that people know who you are and where you're connecting from. Over to you, Negin.
Thank you. Hello, everyone that can hear us or see us. I'm Negin. I'm Iranian advocate. I have type 1 diabetes for 13 years. I'm glad to be here.
Thank you for accepting our invite. People may just need to know that I believe everybody has got a unique story to tell on how they got diagnosed. If you may just tell us briefly about your diagnosis story.
I was 7 when diabetes symptoms start to appear. My family didn't know that type 1 diabetes exists. I don't know if you guys have the same thing in your country, but here, whenever children feel bad or feel sick, elders make chai shirin, which is a very, very sweet tea. It wasn't working for me, so I get worse. They brought me to hospital and we found out that I have T1D.
Right. So again, thank you so much for telling us briefly about your own diagnosis story. Everybody has got a unique story to tell, and we've been hearing all that from people. So that's really great. You're connecting from Iran, and we know there's a lot happening. So many things happen. So maybe if you can just describe how it is like to live with diabetes in a country like Iran.
I don't know how I can describe a day living in Iran. To be honest, if everything was fine here, I would never feel bad to describe living with diabetes as a very difficult situation. But Iran has many international problems and sanctions due to the terrible policy caused by the incompetence of government officials. They wanted change, but they got the power. Living with diabetes nowadays in Iran is like seriously hard. Problems like the dearth of insulin or the rareness of the blood strips, unfortunately, are still here with us, trying to somehow survive. It's just not a really good condition here.
Yes, we have connected. We met together in Portugal. That was good. And we discussed a little bit about the things that really happens over that side. And we know that there was an outbreak of, what can I call this? I don't know if it was a civil war or it was just a war. If you may just tell them what have been the changes since that outbreak. And I know, of course, people have to go to their hospitals, visit their doctors at least 3 months at a time. But then when there are such harsh conditions, people may try being home, staying indoors. So what were the changes or maybe the challenges that people started to face as a result of these calamities?
The concept of the processing is you have to stand against the power of that you don't have. It's actually hard for normal people to protest in these conditions, but diabetes are especially in a very hard situation too, because streets were not safe. We were in a serious fight and war against everyone else, the people. Changes were not good, actually. To be honest, it's getting worse. Everything is getting worse. The government really don't care about it. We can find CGMs or pumps easily because they have to import them from other countries. They're so expensive. We used to live with bare minimum of everything. From the first days of the pandemic, they said that we can't import blood strips. They become so rare. We were told to use internal glucometers, but they're not valid at all. And they require a lot of blood amount, Then we switched to other glucometers because they were not valid. But now it's like the fourth time in 3 years or maybe two that we're changing our devices because they're expensive or they're rare. Nothing is getting better. I don't know why. They're like, we don't care.
Usually when things like this are happening in any nation or in any country, when things are not really okay, in Zimbabwe, we are going to have elections in 2 months. And what I decided to do was just to buy plenty of insulin supplies or diabetes supplies so that, because I don't know what may happen after the elections, the atmosphere might be bad. Maybe people might not be able to buy supplies for 5 months and stay home. How are you getting your diabetes supplies yourself? And has there been any challenges with regards to how you're getting it and how you've been getting it and how you're getting it now?
According to what I described, it depends on what brand you use for your diabetes supplies, but there have been lots of sessions with the Ministry of Health, but there's still the blood strips and other supplies. Only the insulin is insured, but anything else is not insured. So if you can't find the things that you want, you need, it's your problem in here and no one else. That's really sad. Only objects for them to their markets and their business, from the pharmacies to official dump. But here we try to find our supplies in pharmacies. There is no place that belongs to only diabetes, so we have to go to different pharmacies to find different things for our need. And it's so hard. People get in trouble for that.
And I know some people may not be comfortable to speak about these things, how things are. They'll be afraid for their lives. You're a young leader in diabetes representing Iran under the International Diabetes Federation. We know everybody to be accepted. Everybody has got projects that he or she has to do over the 2 years. In your case, how are you going to achieve your goals? If the project that you wanted to do at first, is it still the one that you are going to do with all the changes that have happened or occurred?
We were talking about projects in Lisbon. I was focusing on children who are diagnosed with diabetes. They're actually students. They go to schools like half a day and they have to have very secure and safe place. Problem that I have faced many times here is that these few months streets were not safe for not adults only, for children and everyone. Other problem that I don't know if you heard about it, I think we were talking about it last month. It was that hundreds of schools were deliberately poisoned by using chemical compounds. It wasn't safe. I had to stop my project because people were afraid to go to schools and students were staying at home to be safe. And now schools are closed for the summer break. I'm really trying to find a way to replace some parts of my project with the possible options, but I'm still hanging on that project because it's very important for me to make T1D students to feel safe and feel secure.
This is really interesting, and with everything that you're talking about, and I can also try to relate with some of the challenges that people were sharing with the idea of the previous young leaders in diabetes when COVID-19 hit. People had to change so many other things. And in your case, this is not unique because war, you'll be afraid for your life. You can lose this in a second. We don't want that. Okay, so Negin, I don't know. Let's say, for example, we know that people all over the world, there is so much happening, maybe in countries like Ukraine. I think you know what is happening there. In Sudan, things are not really okay. Some people had to flee their own countries. If you could maybe voice, let's say you get the chance, because, you know, recently we had other people who had to go and speak at the United Nations, people living with diabetes that were representing us. So if you could get such an opportunity to speak with world leaders, what would be your big ask so that people in Iran can get the help, especially people living with non-communicable disease, not just diabetes?
I used to think that diabetes is just a condition that happens to me, but now it's like diabetes is not just a health issue. These days, it's more like a business that forces the target society to adapt to any situation that they can make. We have no choice but to adapt to it. We have to use to live with that condition that they make us to do. I'm just trying to tell everyone that these problems are beyond the capability of any advocacy association or any advocates that are working on it. We can't import CGMs, we can't import blood strips. It's beyond us. I can ask them to hear us, to share our voices, to make them notice. And everyone else that are facing these situations like war or the protest, they have to take care of themselves to help other people. Sometimes cannot do much, but we can take care of ourselves to not getting any worse in any situation or any condition that can happen.
In this case, usually we know, let's say, for
Thank you.
example, any country is involved in any conflict, could be a war, could be an outbreak for like a condition like COVID-19. Other countries or other NGOs from international communities, they will try to intervene, trying to help. For example, Life a Child, they've been donating so many things. Insulin for Life, they've been donating so many things to countries like Ukraine. And even now, the IDF is actually calling other networks to contribute to the people living with diabetes in Sudan. Has there been anything like this? Any initiative to support from the outside world?
Yeah, I don't really think so, because the government here is against us, against people, against everyone with any situation. So they cannot help us because they won't let them. I was kindly asking if anything that can happen, we can get help from outside, but I think it's not possible right now, or NGOs are not capable to do that. They don't have the power. I don't think that could be possible here.
I think I can relate with what you're talking about, because recently we had a bill in Zimbabwe that was signed that no citizen of Zimbabwe can sit with any foreign government. No one can sit with any NGO from any other country seeking for help, because our government is afraid that somebody might overthrow them. So they wouldn't want anybody to sit. So I know if your government cannot allow outside help from other countries or other NGOs, I can relate. And I know if the government is against it, then there's no way people can come in to help people in your own country. Though, of course, you might need that kind of help. It'll be very difficult. And what can we do? We just have to continue advocating however we can.
In pandemic era, we have to face the coronavirus with any vaccine brand, but not Pfizer or any other European or Western vaccination. We were not allowed to do that. We only have Chinese vaccine and Russian, I guess. I don't know, right? But we were not allowed to use Pfizer. It was so bad that people died because of that. They were not responsible for that. Like, they have the power, but they won't use it for people. And that's really sad. I cannot talk about it and not get upset about it.
Yeah, you usually get emotional when you know that you've been in the outside world, you know how things are getting down, you know how other people are doing their own things, but then you might just feel like your country, you're only in your own bubble. Let's say, for example, a country in Europe, and it's well known that the most empowered communities are in Europe, and then you find yourself to be the only country that doesn't have enough. Feel like you're in like Zimbabwe, you wouldn't know what to do, but it's sad. We don't want that. We hope that the leaders that we have would be compassionate and feel for the people that they represent, so that things would be well. The quality of life for people living with diabetes would be amazing too. And again, what do you think should be done to help support the local people living with diabetes in Iran? Of course, you said there are challenges with regards to access to diabetes supplies, but then I'm afraid I cannot start to ask about diabetes awareness itself. Even in Europe, diabetes awareness is critical. People need it. So what would you say should be done to improve the diabetes community of people living with diabetes in Iran?
I think that we should work on the awareness of diabetes, because some people think that it's like death to get diagnosed, or maybe they get it so easy that they think we don't have any condition, we don't have no worries. I think the awareness of diabetes would be a very powerful thing to any community. People here are having more needs than that, because insulin here is not accessible in every pharmacies or any town. In Iran, we have lots of deprived areas that have nothing, like they don't have electricity or usable water. People live with that conditions, and they need to be heard. They need to be seen. And I think the other thing is meet the need of the glucose testing, because I know lots of people that are not testing their blood sugar because they don't have the supplies. It's a very sad thing that people are living with that thing. Even if we get them supplies, we take care of them, they would like sell them, forget the money. In this community, in this society, we cannot talk about idealistic things like awareness or anything. People are they're facing the needs of that. It will take all the idealistic things aside.
I believe you are brilliant,
Thank
you're smart, you're fierce. The sky is the limit. You're going to do great. Thank you so much for being so bold to speak about these things. And I believe even people older than you or people my age might be afraid to speak about these things. And I remember there were those moments that when you said, oh, I'm going to be going into the streets to join others so that we can defend ourselves. Thank you so much for being like that.
Yeah.
We need advocates like you. You're still young. There's a lot of potential. This piece of podcast is going to be encouraging to so many people and inspiring. You're going to inspire so many people because they're hearing this from a young person like you speaking about this. You have your own project with the idea that you're going to do, and I believe you're going to accomplish everything with all the challenges that you're facing, but you're still going to do it. If you give us the words of advice to people who are going to listen, what would you say to them if they might have similar challenges?
First of all, thank you. It's really kind of you to tell me all those kindly words. If I have to tell them a thing that would encourage them to do the things that maybe normal people won't do or be afraid of doing that, I would say that stars can shine without darkness. So if you're facing a very hard problem, maybe that's the darkness we need to be shine, to be seen, you know. One day we will get over everything. One day we will live peacefully. If we're not doing that, if we're not living peacefully, maybe we can do something that next generation will be happy one day. We have to do that. It's not only about us. It's about humanity. It's about people living in next generations. We should see that in very wide perspective and not only think about each other like ourselves. We have to think and take care of each other to live in these situations.
That's well said. I would say bravo.
Yeah, thank you.
Thank you so much for being here with us. I'm just hoping that very soon you'll be able to get access to the CJMs, the latest CJMs that you so wished you had access to, knowing that you have friends all over the world who are using it and saying good things about it. I'm wishing you the very best for you and all the things that you're going to do. More power to you so that you stay strong. Please take care of yourself. And thank you so much for joining the Diabetic Mode podcast. Apologies to the people that will be watching this because I believe there are so many things that I wanted us to talk about, but then there were a lot of back and forth and again saying we cannot be discussing about these things, otherwise something might happen. So we had to give you this piece with all that we had to cover on this session. And again, you gave us your words of advice. I don't know if you have people that you want to say hello to, last words before we close.
Maybe I will tell the protestors in Iran that one day we will get rid of them. We will live peacefully. In Persian, we say that یک نفرم از ما بمونه برای اینکه بخواد خوب زندگی کنه کافیه. It means that if only one person would be living happily ever after in Iran, that would be good. That's like the hope. Yeah, thank you for inviting me to this podcast. Thanks to everyone that is trying to make the world feel better, make the world a better place. Thank you all.
Merci beaucoup. Thank you so much. You're a bit more linguistic.
Yeah.
You love languages.